stroke. I told you first killer is what? Heart attack.
Heart attack.
This is, in some studies, the fifth killer. Okay, but nowadays, maybe it will be becoming the second killer. Heart stroke, or head attack, or a brain attack, you can say like that. Here, if there's a problem happening in the right side, the left side of your body becoming paralyzed. If you're still alive. Okay? That's what you call stroke. Because do you know this one? This one you know from schools. The right side from brain, control left side. Okay? Good. What's the problem exactly? There is a problem, attack happened here in the brain. Then will spread and all this part. You see these two parts. What's the problem? Two reasons. One reason is a block, exactly as happened with the heart attack. It blocked. Why this block happened? The same 10 factors. And who smoke, if he not die from heart attack, he will die from a stroke. So be careful. I try to give messages for the smokers. Okay? Laughing, why? Right.
Already.
There is one reason. A second reason is bleeding. Small artery explosion, burst. Why burst? Because the person has high blood pressure. The normal blood pressure is 120/80. This is the maximum. This is normal. If you have 140, 150, this is high blood pressure. 160, 170, 180, or 200. Sometimes the blood pressure coming like that. So too much pressure through the arteries. If there's a small artery, maybe this is burst and tearing. So what happened? Bleeding. And the bleeding will accumulate until make push on the areas of the brain and also make paralyzed. Okay. طبعا these two reasons, the procedure for treatment different. A treatment for this reason can kill this reason. Some of reason is block, correct? The other is bleeding. For a block, it's good to give aspirin. But for bleeding, if you give aspirin, you did kill him. So how I know it's a clot or bleeding? You don't know. Doctor, how we know? He don't know also. What he do? Make scan. So need a scan, CT scan or MRI to determine the plan of treatment in the hospital. So what I do for you, your role as a first aider to recognize this case very early and send it to the doctor. If you send this person very early to the doctor, to the hospitals, and they are make scanning and they know the reason and give the correct treatment, inshallah the paralysis will be not happened. So the time is very important. How I know this person complaining from a stroke? You see, there's the two reasons. Block or bleeding. The same factors, huh? You remember that?
Yes.
You see that? Look for the face. Stroke.
stroke is another medical emergency for which you may need to use your first aid skills. Strokes occur when blood stops flowing to a part of the brain. This can happen if a blood vessel in the brain is blocked or leaks. Many people can be given treatments in the first hours after a stroke that can reduce the damage and improve recovery. Therefore, it's important to recognize the signs of stroke quickly and get medical care fast. You can use the FAST method to
Fast. F-A-S-T. F. Remember this word, huh? F for
recognize
face.
the warning signs of stroke. It's a simple way to remember the warning signs of stroke, which are face drooping. Does one side of the face droop or is it numb?
One side of the face dropped. Like that. The arm. A-arm.
Arm weakness. Is one arm weak or
There's a weakness in one side, one arm. And if you ask him to rise both arm, one arm, he can rise, the other arm cannot. So this is weakness in this side. There's another point.
numb? Speech difficulty.
Speech difficulty. He cannot speak very well. If he like that. So he feeling very difficult to produce the sound. And the word is not clear. Okay? 3 points, 3 signs. If you see the signs for any person, directly put in your mind this person has a stroke. So the time is not
Is
with
speech
you.
slurred?
Time is very important.
911 if someone shows any of these
Call for
symptoms.
help and tell him the time when you recognize and see this case. Okay, clear?
If you see these signs and think someone is having a stroke,
Seizure. What mean of seizure? Convulsions. Convulsions. Okay?
All right, right, left, and go.
Look for this girl. Look for what happened with her.
Again. Again, right, left. Right, left, a little faster. Right, left.
Suddenly
again.
falling down?
Right, left. Darla? Daddy? There's something wrong. Darla, are you okay? She's having a seizure again.
Seizure. Okay? What's the seizure? Seizure meaning the person suddenly falling down with the stiffness of his body. Stiffness and falling down. After that, during when you're in the ground, jerking. Okay? All of that is few minutes. 3 minutes, 4 minutes, 5 minutes. Then he will relaxed, still unconscious, maybe for a few minutes. Then he will wake up very tired. This is the attack of seizure. The big type of seizure like that. Okay? And this is also not too much common, but maybe happened. Okay? Good? Now, at the beginning, he falling down, correct? Falling down, becoming not conscious, stiffness, and falling down. Falling down where? On the floor. What's in the floor? Carpet or ceramic? Ah. So the head hitting that? That's ceramic. What happened?
Injury.
There's a glass, table for glass. Glass broken and piece of glass coming inside the chest. Okay? So the problem here is while when he falling down. It's very important. So if you stand beside this person, try to guide him in safe way. Put something under his head, pillow or folded jacket, because he will, during jerking he will still hitting the floor. Get that point? Yes. Continue.
Everyone to stay back and please move these things away from her so she doesn't get hurt. Beth, I need you to phone 911, put it on speaker mode, and leave the phone here next to me. I need you to go to my office, get the first aid kit. It's right on the wall right next to my desk. Okay.
911, what's your emergency?
Yes, we have a woman down on the floor. We think she's having a seizure.
What's your address?
We are at the karate studio off 5th and Lamar. Yes, 5110 Lamar.
The Karate Studio at 5th and Lamar. 5110 Lamar. We're sending paramedics, so please stay on the line.
Okay, thank you.
Should we put something in her mouth for her to bite down on?
No, you do not want to put anything in a person's mouth when they're having a seizure. Darla, are you okay? Are you okay? Her seizure has stopped. She's moving and breathing, but she's still not responding. Darla,
During attack, what's she doing? She asks for help. So remove away all the furniture or what's will be harmful to him.
No.
Okay, put something under his head. It's better to put him in side position if you can. Okay, because there is some secretions coming from the mouth. So let the bleeding going outside. Okay, because during the attack maybe he secrete some fluid. Sometimes he pass urine. All of that maybe happened during the attack. Don't try to restrict his movement. And if he's like that, don't make it straight. Leave it. Don't adjust his movement or restrict him or hold him. Not like that, it's not correct. Don't try to open his mouth to put something between the tooth because maybe he bite his lip or tongue. This maybe happened. Don't try to put something between tooth to save the tongue. Leave him to bite his tongue. Don't worry about that. If you make it like that, maybe make a trauma bigger than this wound. Okay? Don't try to restrict his movement and open his mouth. So what you do, just waiting until the ambulance arrives. After a few minutes, the attack finished. After attack finished, he relaxed. Put him in side position if you are already not put it. Then see if there is any bleeding or any wound or any injury happened from the falling. You can give the first aid. Okay?
Black. It's Dottie.
Of the arms, legs, the person from injury. There are also some myths about what you should do to help someone who is having a seizure. Some of these can actually
A
harm
lot
a
of
person
myths
instead of
really
helping.
about
This
seizures.
video and your student workbook provide the correct information about caring for someone having a seizure.
Some people,
Put this in between.
okay, some people think that there is a genie with this patient. He make this seizure. It's wrong. Some people they are open the hand and put some metal in between. He think this is absorbed electrical things. This is wrong. A lot of myths.
Yes.
Okay, I hear a lot of stories from the students. Okay, yes. So what you do, as we explained, if there is a bleeding, you can, after attack finish, you can stop the bleeding.
Darla, it's Dottie. I'm here to help you. What happened? You had a seizure. You remember the lesson. We phoned 911 and the paramedics are on their way. Oh, my mouth hurts. I think I got my left. I'm gonna do something for that. Put this in between your lip and your gum and press down. That should stop the bleeding.
Okay.
They're in the break.
Yes, there's a man here, he's...
Chew that up and swallow it.
Which is caused or has a heart condition. If a person faints,
Is it your right?
Another condition, diabetes. Diabetes is very common here in